No one's going to replace the human brain that can really put all of the complex pieces of a patient together and then determine what's in their best interest and the sequence of treatment and all of that. But there are a lot of things with AI and other types of technology that can help us do that a lot better. Isn't it better for me to spend my time on detecting those things that could be an imminent emergency or a life-threatening situation than it is for me to spend 15 minutes scaling or polishing every little speck of stain? Because that's how I was taught in hygiene school doesn't mean that's how it has to apply today. They're two different worlds, and we learn things that get us to licensure, and then we have to continue to learn. Preparation is really critical of knowing, like, okay, here are the list of patients that I have, and here's what I know about these patients, and so I'm going to be prepared to talk about X adjunct.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, an Endeavor Business Media production. I'm your host, Andrew Johnston, and thank you so much for making us a part of your day. Today's show will be super helpful. It was absolutely a nice refresher for myself, so I think it will be also for you as we welcome back in Rachel Wall to the show. So we recorded this episode at the Voices of Dentistry conference, and it was just so much fun to catch up and listen to her expertise. And as I mentioned on the intro in the last week's episode, I've really come to respect Rachel a lot over the last few years as being someone who can balance the conversations that we need to have about business as dental hygienists, but also staying true to our roots as clinicians. She puts the patients first, and it's wonderful that, oh, by the by, there is production coming from the hygiene room when we're doing the right things like utilizing adjunctive therapies. So give this episode a listen and see how it might help you better serve your patients. And then next week, we have another interesting show because it's about a technology that I didn't truly ever think would be in existence ever in my lifetime. Not that I spend a lot of time pondering about this particular part of technology, but imagine if you could a coating that goes into every little nook and cranny, every crevice, every surface in our operatories. Now, that coating will also constantly deliver disinfection, no matter what procedures are being performed in that room. And if you listen next week, you'll hear all about that process of how wiping down our rooms might be a thing of the past. And as a bonus, the guests for that show are none other than our friend Dwayne Tinker, better known as the Tooth Cop or Tink, and his new business partner, Paul. It's a really amazing episode. You're not going to want to miss it. Make sure you guys are hitting that subscribe button. And then in the personal/podcast side of things, later this month, we will be in Chicago Midwinter. And of course, I plan on doing a ton of recording there. I know Erica Flatteau, who you've heard on many of our episodes, is planning on being there. And I know that she's planning on co-hosting with me. So that'll be really fun to meet up with her again. I also plan on attending the AOSH event on that Thursday of that same week. And so if you're going to be there, let me know. And then podcasting all day Friday, probably more at the Midwinter Conference and also some of Saturday. So if you're in the area, be sure to stop by. You can always send me an email. Let me know that you're going to be there. If you happen to be walking by and you see me podcasting, give me a quick little wave. I'd really appreciate that. That is all for me for this week. I appreciate you all so much. Thank you so much for listening. And I hope you enjoy this episode with Rachel Wall.
A tale of two hygienists.
Welcome, everyone, to the interview portion of A Tale of Two Hygienists podcast. We are here live at the Voices of Dentistry. You are definitely going to hear the excitement and the buzz in the background. I think it's technically still a lunch hour, so it's probably loud for a little bit, but then hopefully as Rachel and I kind of get into this, it won't be quite so loud. It's cold right now in Arizona.
It is.
Are you surprised by that?
It's the same temp here as it is in Charlotte, North Carolina.
Oh my gosh.
Yeah, which is not bad. I mean, it's still 60 degrees outside, so.
It was 82 yesterday in Tampa. This is not.
Okay.
This is not.
Yeah. You're not in Florida anymore.
No, I know. I was talking to somebody earlier. I was like, the humidity definitely has changed me too, because I feel like a 50 degree with humidity, I'm like, okay, I'm still pretty warm actually. But here when it's so dry and thin, I'm like, it bites, but everyone's like, no, that's opposite. Andrew, what it's supposed to be. I'm like, really? Okay. I don't know how to. I'm a baby when it comes to cold.
You do you.
Oh, thank you. So, Rachel, welcome back to the podcast. I mean, you've been on. I mean,
couple
dozens.
times.
Yeah. I mean,
maybe
forever.
not dozen. Maybe not
Forever.
dozens of times.
5 dozen times. Basically, my co-host, I think. But one of the first times that you were on, I think you were on at a Voices of Dentistry, right?
I was going to say,
we were actually standing at one of those little stand-up things, right? You know, I like to talk to you about business. I feel like a lot of times hygienists aren't very well versed in business. I feel like a lot of times they are focused on the wrong things with business. And so I wanted to bring you back on because you brought up a really good point when we were talking about at lunch about adjuncts. And I feel like that's almost like a dirty word, like a no-no word. And I kind of wanted to kind of pick your brain about, like, what are you seeing? What is the perspective of a hygienist, and what do we need to know about, adjunctive therapies?
So I think that the dirty word translation of adjuncts could sometimes be upsell.
Yeah.
And I've even had friends tell me, oh yeah, my dentist tried to upsell me on this or that. And none of us want to do that.
Right.
We don't want our patients saying that. We don't want our friends saying that about us or even about our industry, honestly. Because when I hear that, I'm like, oh God, I'm sorry that they had that experience because that's probably not what it was intended to be, but that's how it came across. So the good news is that we have a lot of technology coming that is in dentistry, and it's only going to accelerate just like the rest of the world. And we've got to get on board with it because it is what it is. It's here. And look at how it can help us be better hygienists. I think, I've even heard people say, well, is this going to replace us? Well, no one's going to replace the human brain that can really put all of the complex pieces of a patient together.
Right.
And then determine what's in their best interest and the sequence of treatment and all of that. But there are a lot of things with AI and other types of technology that can help us do that a lot better.
Yeah.
So I would say first, let's look at these things in that perspective of how can this make me better? How can it maybe save me some time? How could it save the patient discomfort or a scary experience? And if we really look at it from that perspective. So I think the first thing to recognize is there's a lot of things that are on the market now that I don't know about and that some hygienists don't know about. And everybody has a lane, right? Even here at Voices of Dentistry, you've got a gentleman that's getting ready to talk about 3D printing. That's kind of his lane, right?
Right.
So he may not know about all the ortho, trends and technology that's coming. So we can't know everything. I'm rambling.
That's right. I love good ramble.
So I'm rambling. So circle that back to, okay, so first let's set our mindset with adjuncts of this is just having more tools in my tool belt to help my patients get a better outcome.
Right.
And when I focus on patient outcomes, it's automatically going to drive business outcomes. If I'm doing things appropriately, if I'm trying to do everything that a patient needs in a prophy, it's not going to drive a practice outcome.
Right.
But it's also probably not going to get the patient to the ultimate goal that they need to have either.
So I feel like part of what you're saying, I think, is as the patient's coming in, we need to be maybe a little bit more honest about our assessment phase and really
100%.
kind of drive, like, we want the same outcome of health no matter what. But if we aren't starting from a true place, if we're calling everything a prophy,
right,
there's no ability to add an adjunct in there because you're calling it a prophy.
So so I think kind of linearly. So to me, the first piece of it is, what is our mindset around the adjuncts as a category? If we feel like it's an upsell, then maybe we need to look deeper, challenge that, and figure that out. Next thing is, I have to believe that this adjunct is in this patient's best interest, or it's going to just end up being a production driver. And sometimes even consultants are guilty of encouraging team members to do things that are production drivers. And we can't keep doing that. We have to step back and say, first thing, why is this in the patient's best interest? And what do I believe about this particular product and who it is good for? So that's the next step.
Do you by chance have a for instance, like something that has maybe been historically like this is what we've used and now this is
a super easy example, adult fluoride. Okay. So anybody who's worked with a consultant, that's what we do. We're coaches and consultants, right? Has probably experienced something like this. It's like, you guys, you have this goal of $1,500 a day. If you just do 4 more adult fluorides, you're going to hit your goal. You're so close. We're like, oh, okay, well, I could do that. And then that means I get this bonus or this or that happens. So it tends to last for a little while, but then our subconscious, which drives our behaviors more than our conscious does, starts thinking, oh my gosh, am I just doing this for this bonus and because I want to hit my production goal? And then we talk ourselves out of it.
Yeah.
So instead, take the time. If this is the service that the adjunctive service that we're going to be implementing or services, let's look at each one of them and say, okay, where is this valuable? How does the patient present where this is valuable to them first?
Yes.
Okay. And then what it means is I have to either have a physical list of adjuncts and maybe like a little cheat sheet. I hadn't thought about that. I kind of like that idea, like a menu for me of, okay, if they present with, they're taking 4, anti-drugs, antidepressant, antihypertensive, and they've had a cavity in the last, year, then I'm going to recommend this. If they have diabetes and they have periodontal disease, I'm going to recommend this.
Right.
And it's not a cookie cutter because it can't be, but maybe that guides us and makes it a little easier to implement as we're kind of getting into the practice of utilizing these adjuncts. So that's the next step is like the why. I have to believe that this is in the patient's best interest. Then the next piece of it is the assessment phase, like you said. If we're sitting the patient down and we're scaling 6 minutes later, which happens a lot, then our scaling is likely going to go all the way to the last minute that we have to call the doctor for the exam. And we have just completely stepped over the whole assessment phase, which is really what healthcare is all about, is figuring out what the patient actually needs versus just jumping in and doing it right away. So in that assessment phase, then we're doing our perio evaluation. We're doing our intra and extra cancer exam. We're looking at the tissues. We're looking at the teeth. Do they have recession? Like, what's happening? Am I seeing some darkening in those dental areas, or do they have some incipient, caries that maybe hasn't, like, it's not a big hole yet, but what are some opportunities that we have here to make this patient's dental health better? And sometimes I can make their overall health better. So that assessment phase is critical, and also looking at their medical history as part of that. What are their risk factors? And then deciding, okay, how am I going to proceed? And I think it's wise. Sometimes it's difficult to determine this, but I think it's wise to figure out what is the most important thing that I can do for them.
Well, I mean, yeah, I'm triaging, right?
Exactly.
You're like, hey, this is...
That's right.
I think one of the, like what you're talking about is... I don't want to say it's like perfect dentistry. It's ideal dentistry. This is what we want. Right. One of the things I really like about the softwares of today, I can't remember exactly the last one that I looked at, but you mentioned having like a little checklist, a little cheat sheet. So what they had done is they had put that same checklist into their software so that when you move on to that next phase of the assessment phase, if you are looking, they have these anti-drugs. It puts them at this caries risk. This caries risk populates then this treatment
procedure
plan, et cetera, et cetera. And you go through multiple parts of the assessment, and it almost spoon feeds the dental professional what needs to go. And then you can go to, you talked about, the triaging. It's like, okay, well, the patient is coming in with, an abscess, and of course they want whitening and the things that we always hear all the time. It'll help us drive in a scientific way, a scientific discussion with the patient about their health and why they really need to have the disease focused first. I really like the technology, though. There's a lot of really good technology out nowadays.
And I will say it's ideal. However, I don't think it's as hard maybe to implement this as we make it out to be. It's really prioritizing and believing also as a hygienist that assessment phase is really the most important thing versus the scale and polish. But I get it, because the patients, they've been trained by us, right, to think that the scale and polish is the most important part of it.
Because we've also been trained by our education system that's what it is. And so then we train the patient. It's a nasty, vicious circle.
So I teach a program on hygiene time management, and I show a picture of a before and after of a patient I had who drank 5 glasses of sweet tea a day and had just brown stain all over the back of his anteriors, right? Well, the after picture I would have failed in hygiene school. But, my dentist, I have to give him credit for this. He's usually here at this event, but I don't see him, Dr. Chris Bowman. He's like, look, I've never seen a stain emergency.
Yeah, I like that.
But I've seen a periodontal abscess. I've seen a broken tooth. All these other things. I've seen patients that have oral cancer. So isn't it better for me to spend my time on detecting those things that could be an imminent emergency or a life-threatening situation than it is for me to spend 15 minutes scaling or polishing every little speck of stain?
Absolutely.
Because that's how I was taught in hygiene school. Doesn't mean that's how it has to apply today. They're two different worlds, and we learn things that get us to licensure, and then we have to continue to learn.
Yeah.
Constantly.
I wish that message could be brought up to every single. It's got to be like after 1 year though, because you're settling in that first year, and you're just trying to get up to speed, and then you can focus on your next step. Let me ask you this: are there adjuncts that you found in all of your coaching that people are particularly pushing back against?
People are patients or hygienists?
Both. Yeah. I think back to like when I worked at the last DSO, one of the biggest things that we got pushed back was irrigation. And irrigation has had, depends on what science you look at, right? It depends on what product you're using. So one of the things that's really popular right now is iodine, right? Molecular iodine, more so than, Providone iodine. And we would get a ton of pushback from our hygienists if we had like chlorhexidine irrigation. I understand that. I understand both sides of it. But overall, we as a company still believed a certain standard that a lot of the hygienists didn't believe in. Are you finding that, in other areas of adjunctive therapy as well?
I mean, I think we see that sometimes in just even treating periodontal disease, which is really surprising. And I would say 90% of the time we can overcome that because we go back to, what do I believe? What do I believe about active infection? What do I believe about what I can accomplish in a prophy? What do I believe about, I want to have time to do we're asking for time. It's like, okay, you can have the time, but you have to diagnose to get them into a procedure where you have more time to do the treatment.
Sure.
But as far as adjuncts go, it's interesting. I'll tell you one that just came to my mind, but it's sealants. And not necessarily pushback from hygienists. And to be honest, at Inspired Hygiene, we don't really teach that much. And part of that is because I came from two separate practices that the doctor's philosophy did not support sealants. So that's probably why.
That's interesting.
And I also, that was 20 years ago.
Yeah.
10 to 20 years ago. And we have some incredible products that are on the market now for sealing and also regenerating enamel. Like there's some really amazing things that are on the market right now that are going to become a lot more prominent in the next year or two.
I'm glad that you brought that one up.
That can be used by hygienists.
Our numbers support exactly what you just said, though. And it's funny now, because I didn't think of sealants as being like adjunctive therapy, but it is. But when we were looking at all of our metrics, for a couple of years there, you could tell the practices where they were believers in prevention with sealants, and then you would get another 10 offices in that same region who just did not place a single sealant. And we had all of the tools. We had the ones that were with wet bond. We had the glass ionomer sealants. We had every tool available that they could choose from if they really believed it, right? That if they knew that there was a benefit for the patient.
Yep.
And we got a lot of pushback on adult sealants. Interesting.
So I think that goes back to then spending time on the why. And so you probably did this in this DSO, right? But what I would say is like clinical director is, okay, let's get, because it starts with the dentist, particularly that procedure. Okay, what do we believe about sealants? Just throw it all out there. And then where is it valuable? Where is it not valuable? Okay, then let's build a standard of care from that. And these are all the products that we have now. So all the dentists are calibrated for the most part.
Sure.
And then now let's bring it to the hygienists and dental assistants and the business team, right? So I think it's like, okay, let's take a step back. And instead of keep pushing forward on like, why aren't you doing sealants? Like, well, let's listen to them. And again, you probably did that. But let's listen to them. Like, what are your objections?
Mm-hmm.
What is the experience that you have that is fueling that objection?
Mm-hmm.
And can we come up with another approach?
Can I tell you what the answer was to that when we did do those things?
I don't know. I just don't want to do it. I think it's an upsell.
It's actually not. Believe it or not, we didn't do that in dental school. That's not what we were taught in dental school. It was always pediatrics in dental school.
And we hear that from hygienists.
100%.
Yes.
Because at least I don't know what it is now, but I didn't graduate that long ago. But
I did. It was a long time ago.
In the mid to late 2000s, we had our pediatric sealant requirement.
Yes.
We didn't have an adult sealant requirement.
So it must not have been important. Must not work.
It's just like it wasn't something we were ever graded on. So yeah, it must not be something that is important in the real life. Yeah. So I get where everyone's coming from, but it's just so weird how like dogmatic we can be about this thing of, well, 20 years ago they didn't teach it this way, so of course it's not.
But there weren't the same materials 20 years ago,
which is true.
And I didn't take digital X-rays in hygiene school. But do I say I will never do that? I'm only using film.
I'm going to dip them forever.
No. I mean, you guys, and in fact, in the dental hygiene oath, I put this in some of my lectures, it says we must continue our education to the benefit of our patients. Or I'm paraphrasing that, but that is a requirement. We can't. Yeah. If I still did things like I did them in 1991, that's shameful.
It is. Absolutely shameful. Okay, so adjunctive therapy is really important for the outcomes that we're looking for our patient health. Yes. Okay. We know that. Set that aside. Now we have a whole business perspective.
Uh-huh.
And I know hygienists generally are like, well, it's up to the doctor to run the business, doctor, or office manager. I don't care about any of that. So I guess my question is, one, why should the hygienist care? And then two, what are some metrics and goals that they need to be paying attention to? And then how does adjunctive therapy kind of tie into all of that?
Okay. So why should they care about the business side of things? Mm-hmm. Because they're part of the business. And in order to care for our patients, yes, a hygienist could leave and go to another practice, but we have to run a profitable business to keep the doors open and to have a job, right?
Yeah.
I mean, now we're in a time where hygienists are very much in demand, right? We could find another job. But if you like the practice you're in, it's in your best interest for it to be profitable and for it to continue to improve and grow and add technology. If we want new instruments, if we want improved instruments, if we want the latest subgingival air polishing and those kinds of things, that just doesn't come out of thin air, right? It has to come from a profitable business. So there are lots of reasons why we should care. And also so that we are contributing to that. And I would hope that if the hygienists, the team members are contributing, that there is a piece of that is benefiting them as well. I do not think it is an unreasonable expectation for team members to feel like, hey, I'd like to have a little benefit when the practice does well. I think that's a very reasonable expectation. And I think most of our clients and most progressive dentists want to offer that.
Sure.
Or at the very least, they're like, you know what, I'm going to pay my team members the highest hourly wage of anybody in town. Or I'm going to pay them a reasonable wage and they have an opportunity to make more with either a team bonus or some type of incentive, that kind of thing. So that's why they should care. And an industry standard that has been around for a long time because of math is that the goal is that a hygienist produces 3 times their compensation.
Yep.
And that's their compensation package, right? Their benefits, uniform allowance, all of that. 3 times that is their net production. I will say that is being challenged in the last couple years because of increased wages and decreased reimbursement. So practices that are very heavily involved with certain insurance companies have seen a just direct cut on reimbursement across the board.
Yeah.
And it makes it very difficult because hygiene procedures are not the highest production procedures in the practice, right? I mean,
sorry, I'm not questioning you.
I'm going to say a progressive general dental practice that are doing high-level aesthetics.
Yeah.
Maybe they're restoring implants. They have, more than just a drill fill practice.
Yeah.
The dentists are doing adjunctive care and semi-specialty procedures, right? Okay, if we compare hygiene fees to that.
Gotcha. Yeah, it's not.
That's where I am.
Yeah.
Okay. So it's that 3-to-1 is being challenged hard. And there are some dentists that are saying, you know what, I'm okay, because I'm okay being in this heavy in-network model. I want my hygienists to be paid well. And if we do 2.8-to-1, I'm good with that. And others that say, no, we're fee for service, and I would like for my hygienist to be at 3.5-to-1, and they're going to get this X percentage of that. So that's one metric that you can look at. And if we have adjuncts and technologies and things that are available that can make our patients' lives better, then those things are also going to drive hygiene production and drive those business outcomes and get us closer to that 3-to-1. And I was listening to another podcast in the DSN network, and it was fantastic. It was one of their DSN doctors and their hygienists, and they were talking about how they prepare. You have to prepare for your day. You cannot expect to just show up and just see the first patient and just like
wing it
and expect for the day to end well, right? So that preparation is really critical of knowing, like, okay, here are the list of patients that I have, and here's what I know about these patients. And so I'm going to be prepared to talk about X adjunct. And then I kind of have my mind set that I'm going to bring that up. It's hard. I would say it is hard to talk about adjuncts and bring it up if I'm just winging it from one patient to the next.
Right.
Because it's a lot of mental processing. And if I'm doing all that while I'm cleaning my room and turning it over, it's a lot less likely to happen.
Yeah, you can't focus and prioritize the things in the right way. And I think one of the things I like you said earlier in the show, but I really think that if you can, prepare for the patients, but if you can use adjunctive therapy to make your life easier, then you need to. It will save you time. There are plenty of products out there that'll get the patient so healthy that perio maintenance visit is going to just fly
That's
by, right?
That's right.
So you should invest in this just to make your life easier, make your life happier.
Yep.
Make your, especially if you really like where you're working, you want to be happy at work. So quick question. What are you doing now? I know this is kind of like out of the blue, but I feel like it's been a little bit of time, and I wanted our audience kind of catch up with you.
Me personally?
Yeah. What are you up to?
So I'm running Inspired Hygiene. 2022 was a very interesting year for us. We had some key member team transitions like a lot of our client practices have. So, it's interesting when you see that from afar and then it happens to you. You're like, oh, yeah, this is what they're talking about. This is why they won't answer our phone calls. So kind of running on my hair on fire because a lot of those tasks that land on me, right? Because I'm at the home office and our coaches are primarily on the road working with our clients. They're phenomenal. So our primary goal in Inspired Hygiene is to help inspire other hygienists and teams to elevate their level of care, elevate the systems they have, because that allows us to do this in a reasonable way and in a timely way, which ends up increasing profitability for the practice and hopefully some yield for the team members as well. So I'm running Inspired Hygiene. We are right now, it's January 2023, about to release a very much new and improved version of our Perio Protocol online bootcamp. So anybody who is interested can go to periobootcamp.com and learn about that. It's like a DIY way to create your own Perio protocol within your practice.
Just so important.
Just looking at growing, how we can serve our clients and what we can bring to them.
We have a lot of new grads, a lot of educators listening to the show, and you're a wealth of knowledge. What messages do you have for the younger people?
Well, I think it's an exciting time to be entering dentistry because there is so much technology, and it's really fun. And I feel like dentistry is kind of being pulled into the new age, which we're always a little bit behind the curve, right, with technology and things like that. But I feel like we're there and it's accelerating quickly. So I would just say, just keep your mind open. Speak your mind in a respectful way. If you end up in a practice where the protocols are not up to even what you feel like is a minimum standard of care, be willing to say in a respectful way, I'd love to help develop a perio program. Like, are you open to that? I'm willing to kind of help take that on and work with you to do that, for example. And I would say just don't be discouraged. Surround yourself by people who love dentistry. Surround yourself with hygienists who love hygiene, and you will likely have a long career. I think we're getting the chime here.
We're getting the absolute chime.
It's like the hook on stage, right? We're getting
exactly.
the hook.
It's like, Rachel, thank you so much for coming back and being a part of the show. If someone wanted to reach out and find you, where can they find you?
They can find me at inspiredhygiene.com. I'm also on social media. I'm on Instagram, Rachel Atwall, Facebook, all the places.
Awesome.
Yeah.
Thank you very much.
Everybody.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.